Hello, guys. My name is Brittany. So, the topic I chose for our final presentation was about addiction and how it affects our brain. I chose this topic because, as I've mentioned before, I work at a substance use and mental health rehab. I work one-on-one with people who've gone through addiction and they want to get better. We get these people when they have hit their rock bottom in their lives. They get sent to detox for about 5 to 7 days, and then they come into our program to learn how to stay clean and work on themselves. Since I've worked with people going through addiction, I thought it would be good to do more research on how addiction affects the brain. So, to start, we are going to first learn what addiction is. Addiction is a state of psychological or physical dependence on the use of alcohol or other drugs. People who are going through addiction could also develop a substance use disorder. You know it's a disorder when social, occupational, legal, or interpersonal needs are neglected. People wouldn't be able to function in daily life. How does addiction affect the brain? Every substance has slightly different effects on the brain, but all addictive drugs like alcohol, opioids, and cocaine produce a pleasurable surge of the neurotransmitter dopamine in a region of the brain called the basal ganglia. This neurotransmitter is responsible for controlling rewards and the ability to learn based on those rewards. So, as substance use increases, these circuits adapt. They scale back their sensitivity to dopamine, leading to a reduction in a substance's ability to produce euphoria or the high that comes from using it. Over time, people will be able to develop a tolerance for the substance they use. Tolerance reflects the way that the brain maintains balance and adjusts to a new normal, the frequent presence of the substance. Addicts often increase the amount of the substance they take so that they can reach the level of high they are used to. Okay, so now we're going to look more into like the neurobiology of addiction. When we really look at how addiction affects the brain, we see that the repeated use of a substance trains the brain to associate the rewarding high with other cues in the person's life. Like, for example, the friends they drink or do drugs with, the places where they use substances at, and the paraphernalia that accompany substance taking. As these cues become increasingly associated with the substance, the person may find it more and more difficult not to think about using, because so many things in life are reminders of the substance. Changes to the brain areas, the extended amygdala and the prefrontal cortex help explain why stopping substance use can be so difficult for someone with a severe substance use disorder. The extended amygdala controls one's responses to stress. If dopamine bursts in the reward circuitry, the basal ganglia lures the brain towards rewards. Bursts of stress neurotransmitters in the extended amygdala pushes the brain to escape unpleasant situations. In continuation of what was just said, when an individual has a substance use disorder, the balance between the basal ganglia and the extended amygdala drives shifts over time. People feel emotional or physical distress whenever they are not taking the substance. When people get this kind of distress, it is called withdrawal. As a substance use disorder deepens in intensity, substance use is the only thing that produces relief from the bad feelings associated with withdrawal. That is what keeps the addiction going as well. It is a vicious cycle that happens due to the relief that is purchased at the cost of a deepening disorder and increased distress when not using. So, addiction does a lot of things to the body that are extremely harmful. For one, they can have increased heart rates and blood pressure. Their physical appearance changes, like their hair, face, and teeth. They lose weight due to a loss of appetite. They are always tired, etc. They aren't themselves when they are going through addiction. And I can say this for as like knowing people, like seeing them in the beginning when they first come into treatment, like you can see the major changes they go through as they spend time in our program. They gain weight, they have like a healthy appetite, they work out, like they've gained back the body weight they lost. You see major changes from when they were in their addiction to when they're now sober and clean. The long-term effects of addiction goes into the health issues that arise due to substance use. So people can get cardiovascular disease, they can get strokes, they can get cancer, HIV and AIDS, hepatitis B and C, lung disease, even mental health disorders like anxiety, depression, etc. So, how do we treat addiction? Research on the science of addiction and the treatment of substance use disorders has led to the development of research-based methods that help people to stop using drugs and resume productive lives. I can say from experience, we like to incorporate evidence-based curriculum that we teach to our patients in groups, as well as in individual therapy. Treatment enables people to counteract addiction's disruptive effects on their brain and behavior and regain control of their lives. As people go through treatment, there is the potential to relapse, which is when they will return to their use of substances after their attempt to stop. This is all part of the process of addiction and being able to overcome it. It's just a cycle that people go through. So it's up to them if they want to stop that cycle. So, how does treatment rewire the brain? In treatment of addiction, it is said that it's important to use a combination of medication management as well as behavioral therapies. Medication helps with the cravings and withdrawal symptoms. Behavioral therapies help people in addiction treatment modify their attitudes and behaviors related to use. It all comes down to their brain and how we can rewire it after it's been through so much. Thank you for listening to my presentation.